in the IBS population. Interestingly enough, it's also not the case in patients who have reflux. Just to a little aside, some of the patients that have the most severe heartburn type symptoms of reflux, when we do the endoscopy, we see absolutely no evidence of significant inflammatory changes in the lower esophagus. So again, pain, the severity of pain doesn't mean that there has to be something severe inside the body going on to cause that much pain. And IBS, and the example of reflux I gave typically demonstrates that. So abdominal pain from IBS may also typically radiate to the lower extremities, upper thighs, and this is something that we see fairly frequently, and it can again be confused as a musculoskeletal process. Pain can also radiate into the groin or the testicles or the lower pelvic area, sending the patient to the urologist or to the OBGYN doctor, looking for pathology or an abnormality that in the case of IBS isn't going to be there. And again, these people will benefit from a real attempt of treating the IBS symptoms in a very holistic fashion. Rectal spasms are very common also in the IBS population, where sharp shooting pains will actually stop you in your tracks. That shooting up from the rectum that can be intermittent, constant, or some people describe it as throbbing discomfort. The medical term for that is proctalgia, proctorectal algia pain. Fugax just means fleeting, and this may require seeing your doctor again for more evaluation and treatment. Just a little disclaimer, please remember that nothing that I'm giving or talking to you about today is in this video is a substitute for seeing a good specialist gastroenterologist who specializes in irritable bowel syndrome. So lastly, pain can, another option here is pain from IBS can radiate to the hips. And hip pain, again, can mimic musculoskeletal pain. So if a CT MRI shows significant degeneration in the hip area, and it may end up being, again, pain radiating from an IBS picture, again, that person may end up having surgery and afterwards still having the hip pain, again, from an IBS picture. Remember, one of the keys to the best outcome for the IBS patient is the doctor-patient relationship, and support and education for all of the aspects of irritable bowel syndrome. How do we address the gas and bloating? How do we address the pain? Whether it's spasms, sharp, burning pain in the lower abdomen is so frequently, because the person will use the word burning, confused with stomach acid, a stomach acid problem, that people will typically be given acid-suppressing medications, when in reality it's an IBS symptom. So someone can have burning abdominal pain, and that's typical for some IBS patients, because the quality of their discomfort can vary significantly. Sharp, burning, throbbing, just tenderness, pressure. All of these are different qualities of the pain that someone with IBS may end up having or feeling. So what we're really dealing with, unfortunately, in today's very fast-paced medical practices is the fact that unfortunately, the necessary hand-holding that's needed for the IBS patient is frequently missing. And as the system fails, so does our ability to help some of the most common IBS problems in patients to obtain the best quality of life. It usually takes 3 to 4 visits for the average person with IBS to get an optimal control of their symptoms on a specific medical regimen that is, and this needs tailored and adjusted to the specific person's symptoms and their life current events and tolerance to medications and they're close, and then they're closely followed. And so a team approach is so important to achieving the best quality of life, despite having the irritable bowel syndrome. So quality of life and control of symptoms is really the goal. And this leads to patients whose symptoms unfortunately exacerbate and become severe at times. You get patients that present to the hospital for many times unneeded hospitalizations for some of these patients where tests are repeated, colonoscopies may be repeated, CAT scans may be repeated, lab tests are repeated, again to show only normal findings. And again, this is where reassurance and acceptance of what we're dealing with there's got to be a real sit-down powwow to everybody sitting down and agreeing that this is what we're dealing with, this is how we're going to face it together, these are the medicines and the things we're going to do and the lifestyle changes that we're going to make to try to help you get through this so that you can have the best quality of life. There are many medical strategies available to help control, but not eliminate necessarily, IBS symptoms. And the first of these are medicines called antispasmodics. And a long list of these I prepared just for you to look at here.